Hi, I'm Joe Hess, the Director of Primary Care from Colorado Mountain Medical. Today I'm joined by Dr. Samantha Stough, one of our pediatricians here at the Dillon Health Center in Summit County. Welcome.
Thank you. I'm glad to be here.
So happy to have you. I'm interested in hearing from you today. What types of patients, pediatric patients, might you be seeing here in the Dillon Health Center in Summit County?
So we see all kinds of visits here. We see well child care. We see ill visits. We see kids with injuries. Something that we've been seeing a lot of lately has been kids who are sick with different viruses, different illnesses that are making their families very concerned. We in pediatrics kind of talk about this revolving door of viral illnesses. So the second that a child seems to be recovered from one illness, they get a new one. This is something that we honestly expect to happen every year, and that's because kids can get up to 12 viruses every viral season, and we sort of say a viral season is the school year. So August to May, we expect kids to have a lot of illnesses. This is something that's very concerning for parents, and we take it very seriously as well. We know that there are things that you can do to try to help your kids so that they don't get so ill, and just to increase their baseline health.
So Dr. Stough, as a pediatrician, what would be your recommendations for somebody who's caring for their child at home? And then at what point should they come in to see you?
So the first thing I want to think about is how to keep our kids healthy at home, how to give them the best baseline health that we can so that when they do get these viruses that they're not getting so sick. So the first thing I always recommend is looking at sleep. We know that sleep is immensely important for so many different areas of children's growth and development. We know that that is one of the best things to prevent them from getting ill is having enough sleep at night. Really important for that is trying to limit screen time, especially screen time in the bedroom, especially screen time in the hour before they want to go to sleep. That's a huge way to get kids to fall asleep. We want to make sure we're giving them plenty of time. So if we have to move their bedtimes earlier so that they can get enough sleep before the school day starts or before preschool or parents need to leave for the day. Another really important thing is going to be getting physical activity. So kids actually are recommended to get 60 minutes of physical activity every single day. They should be getting outside. They should be doing things that are fun. They don't need to get on a treadmill, but they should be playing, jumping on the couch. I guess that's not always recommended. My kids jump on the couch, and I think it's a good thing. They should be jumping on a trampoline or playing hopscotch in the house. There's things that you can do inside during the winter that still get their heart rates up, still get them having fun, nothing formal, nothing crazy. And then the last thing that's really important is diet. We know that kids prefer foods that are really high in carbs, foods that are not always the best for them, but I always recommend trying to get your kids to eat the rainbow every single week. Really the goal is twice a week. So having a food that is from every single different color is a really helpful way to make sure you're getting all those small nutrients and vitamins that are helpful.
That's really great information. So at what point should a parent bring their kid in to see you?
So there's a few really important things. So a baby who's under 2 months is always at a really high risk of getting especially ill from a typical virus. And they also need to be seen right away if they have a fever. A fever under 2 months always needs to come in for an evaluation. After that, we want to make sure that we're keeping a close eye on how our kids are hydrating. So we want to make sure that they're tolerating liquids, whether it's a baby who's breastfed or an older kid who's drinking Gatorade or water or something like that. We want to make sure that they're able to keep those fluids down and that it's not affecting we want to make sure that we're not having a change in how much kids are peeing. So babies should be maintaining close to the same amount of wet diapers as they usually do. And older kids, of course, are going to the bathroom by themselves, but they should still be urinating frequently. And then the last thing to be really cognizant of, especially up here at 9,000 plus feet, is we want to make sure that our kids are not having any trouble breathing. So that would look like sucking in underneath the ribs or sucking in between the ribs. We don't want to see the skin in those areas pulling in at all. That would tell us that it's definitely time to have the child evaluated to make sure that their oxygen is staying healthy at this level.
That's really great information. So patients can come see you when you're working. You're here in Dillon Health Center Monday, Wednesday, and Friday. When you're not here, we have 2 other family practice providers here and also urgent care providers. So your pediatric patient is always welcome at our Dillon Health Center. Thanks.
Thank you.